If you have chronic pain and nothing seems to help it go away, you might want to take a look at your standing posture. So many of us stand incorrectly, and that can lead to low back pain, hip pain, knee, ankle, foot pain, and we don't really know why. So I want you to just march in place, shake out, and then just stop and land. And don't fix anything, just stand however you're standing and just sort of notice. I want you to pick up your toes, lift your toes. Now, were you able to do that easily? Or did you have to shift your body or do anything to adjust, or was it just difficult to pick up your toes? If you're able to do it easily, your hips are pretty well aligned. If you weren't and you needed to adjust, very often our hips are forward so that we have this shift. Now, that happens a lot because when we're hunched and rounded, which so many of us are with our computer posture and everything is sort of in front of us, we're in a flexed position all day, so we can't walk around like this, but we can't straighten up our backs either. So what do is we move our hips forward. So that gets us up here instead of lifting up through the spine. So a lot of us have this kind of posture with our hips forward. That puts our weight on the front of our feet, so it's very difficult to lift your toes if you're there. What you want to do here is bring your hips back so that the hip bone, you've got a big hip bone, the greater trochanter right here, lines up with the bone on the outside of your ankle, a big bone that sticks out there, your lateral malleolus. If you think of your pants, the seam of the pants would be going straight down from hip bone to ankle, and you know you're there if you can pick up and wiggle your toes easily. It'll probably feel like you're quite far back because you're not used to it. But look, if your hips are forward, how much that's cinching your low back and putting so much stress there, and also just throwing the whole structure out of alignment. Okay, so you want to bring your hips back over your feet. Now the other thing you want to look at is where your feet are pointed. A lot of us have our feet turned out like this. That also is distributing the weight unevenly, and also it can make us bend our knees inside the feet, okay, so that the knees would be tracking inside the feet rather than over the toes. This puts a tremendous amount of strain on the knee joint. You get a lot of grinding and all kinds of things can happen, including chondromalacia patella and osteoarthritis, all sorts of things that you really don't want to do to your knees. So you want to bring those feet to face forward. They want to be parallel. Now, if you are somebody who tends to have your feet out a lot, it's going to feel strange. It's going to feel like you're almost pigeon-toed and putting them in. So that's how you're going to sense it at the beginning. As you practice this over time, it's going to feel more normal. So you want your knees bending right over your second and third toes, so that if you bent your knees over your feet, you should be able to see your big toes in between. They shouldn't be covering them up here. You want them in between. Okay? So what do we have here? We have our hips back in alignment, greater trochanter, hip bone lined up with that ankle bone, and our feet turned forward. Now, another thing that happens is your knees soften when you're in this position. So think about it. If your hips are forward, your knees have to lock in extension to balance you, right? So you don't fall. And that puts also a tremendous amount of pressure on the knees and the quads and the hamstrings. So when we bring our hips back, we can soften the knees a little bit. You always want to have a little bit of a bend in the knees, some sort of softness, some spring, bringing those feet to face forward. And then just feel sort of a lift up, not making anything happen, not forcing anything, but just sort of sensing a lift up through the spine, a lift up through the sternum, an openness in the chest. Okay? Hips over ankles, feet facing forward. You should be able to lift and wiggle your toes, and a lift up through the spine as if there's traction in the spine, as if your vertebrae are separating, making you nice and tall. okay? That's how you want to stand, to really minimize the strain on your joints and to maintain healthy muscles, healthy joints, healthy ligaments. So a lot of us might have trouble actually getting our hips into that position because there might be some weakness in the hip here. So in another video, I'm going to show you how to strengthen that to enable you to maintain that proper posture. But for now, practice this nice standing posture and I think you are going to feel a lot better. Thanks a lot. Give the video a thumbs up if you like it and subscribe to my channel for more, and please do comment below and share your thoughts. Thank you.